Whenever the mitral valve is damaged, and most of the times when it is leaky mitral valve or a mitral regurgitation, in those circumstances, we replace this entire mitral valve structure with a artificial valve. So that procedure is called mitral valve replacement. There are, as we already have seen, that there are two different types of mitral valve problems. One is a narrowing of the mitral valve, also called as mitral stenosis. So when the valve is narrowed, only narrowed without any leaking of the valve, this type of mitral stenosis can be eminently treated with a balloon. Instead of replacing the valve, we repair the valve with a balloon and open up the valve. So this procedure is called balloon mitral valvotomy. So whenever there is a narrowing of the valve, if the valve is suitable, we can do a balloon mitral valvotomy. So the balloon mitral valvotomy is usually performed when the valve area is less than 1.5 centimeter square. So if the valve is narrowed below 1.5 centimeter square, we perform a balloon mitral valvotomy. At the same time, if there is any features of heart failure or there is evidence of severe increase in the blood pressure in the lungs, also called as pulmonary hypertension, then we ask the patient to undergo a balloon mitral valvotomy at an early stage. At the same time, if the valve is leaking, that is called mitral regurgitation. So in a patient with mitral regurgitation, as we have already understood, that there will not be any symptoms in the early phases of disease. So we need to do a periodic echocardiogram to understand whether there is any enlargement of the heart, whether there is any reduction of the pumping ability of the heart. Then we have to send these patients for a mitral valve replacement procedure. So when does a mitral valve replacement will be done in a mitral regurgitation is if the person has got severe mitral valve leaking associated with enlargement of the heart, increase in the blood pressure in the lungs, or there is a failure of the right heart, then we ask the patient to undergo a early mitral valve replacement. For a leaky valve, we cannot do balloon. For a leaky valve, we have to only perform a replacement of the mitral valve. When a mitral valve is replaced and a new valve is put like this, so this valve can be of two types. One is a mechanical or a metallic valve. So normally this tissue is a fibrous and it's made up of muscular tissue, something like that's what, it's not truly muscle but similar to a muscular tissue. So when we have this mitral valve, you remove this valve and replace with a metallic alloy valve. So this valve is called a mechanical valve or a metallic valve. At times, because this mechanical valve have got lot of complications, if the person is more than 60 years of age, we replace this valve with a tissue valve. Instead of a mechanical valve, we have a tissue, means these tissue valves are similar to that of a valve which is given by the God or present naturally. So this mechanical valve has made up of alloy, whereas tissue valve is made up of bovine, that means from the buffalo or from the heart of a pig, these valves are constructed. So these tissue valves are akin to that of a normal tissue and they do not have so many complications. A mechanical valve needs the use of a blood thinners or anticoagulants, whereas a tissue valve does not need blood thinners. A mechanical valve lasts for decades, usually 2 to 3 decades or even 4 decades, a mechanical valve will last, whereas a tissue valve might last anywhere between 10 to 15 years of duration. When a mechanical valve is damaged, the person has to undergo a repeat open heart surgery and replace the valve, which is a high risk procedure. Whereas if a tissue valve is damaged, then we can replace the tissue valve with a transcatheter. That means without a surgery, we replace the valve going through the groin. So a mechanical valve, even though it is durable, it has got a risk of bleeding because of the blood thinner use. Whereas a tissue valve, even though it works for a shorter duration, especially in the elderly people, it is more than 60 years, it is a suitable option because these patients do not require lifelong anticoagulation or blood thinner usage. Patients with mitral regurgitation, if the patient has got a severe mitral valve leaking associated with dysfunction of the heart, or the patient is very elderly, let's say more than 75 years of age, the surgery is considered high risk. So heart pumping dysfunction, elderly age group, or if the patient had a previous mitral valve replacement either with a by tissue valve, then these are the patients who are considered to be high risk for undergoing a repeat mitral valve procedure. Or sometimes the patient can undergo a surgery to the heart like a bypass surgery. In those conditions, doing a repeat surgery for the mitral valve after a bypass surgery is also considered high risk. Similarly, people who have got kidney problem, people who have got advanced age, people who have got a previous brain stroke, those are all the patients whom a replacement of the mitral valve with a artificial valve is considered high risk. For those patients who have to undergo a mitral valve therapy or treatment and not considered suitable because of their age, kidney failure or brain stroke or poor heart pumping ability, previous bypass surgery, previous mitral valve surgery, in those cases we have to consider other ways where this mitral valve can be repaired or replaced. Due to new technological advances, we can repair the mitral valve, because if the valve leaflets are leaky, because there is a gap between those two valve leaflets, for example, you consider these two are the mitral leaflets and there is a gap, you can bring the leaflets together by putting a clip. So the valve leaflets are getting closer and they can be fastened with a clip. So this clip can reduce the leaking or sometimes completely abolish the mitral valve leaking. So this procedure is called Mitra clip or a transcatheter end to end repair. At the same time, patients who have got a mitral valve stenosis, that means there is no inadequate or leaking valve, but instead the valve is narrowed. If it happens after a tissue valve and a damage to the tissue valve, then we can replace the valve using a catheter procedure, that is what we call as the transcatheter mitral valve replacement. These two advances like a Mitra clip or similar type of surgery and transcatheter mitral valve replacement are a boon for the elderly patients with mitral valve disease who are considered not suitable candidates for getting the mitral valve replacement surgery. This is an important advance in those patients with end stage heart failure and a leaking of the mitral valve.